This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Yes, this is for anyone connected to any business that is medical. Doesn't matter what it is. And I have to believe there's a lot going on there, a lot of challenges within that business. The medical field growing by leaps and bounds. Our population is getting older, which requires some more medical attention. So I've got somebody that can help move your organization forward, take care of some of those things that maybe you don't want to do, you're not really sure how to do, maybe grow the practice. And this is all in her wheelhouse. She does a lot in terms of supporting businesses. We're focusing on the medical aspect today. Just Right Business Services LLC is her company, and she is Laurel Jones, and she's back with us. How are you today?
I am great and getting better every second.
First thing that comes to mind when we talk about the medical thing, I'm going to share this because this was in real time just a few hours ago, but I had a friend that was in the doctor's office and she had an appointment, so she's waiting. She gets a phone call and they say, hi, we need to cancel your appointment and the doctor's not in. We're going to schedule for another time. She goes, well, I'm in the office right now. Turns out they incorrectly called her because there's somebody else in their database. And by the way, they thought that she was at a location 3 hours away. Mm-hmm. Somebody with the same last name, somebody with the same date of birth.
Wow.
Somebody with the same first name initial. It was Tina versus Tanya. Mm-hmm. And right away, to me, that says that practice needs to get their act together in terms of HIPAA regulations and more. And why would that happen? Because I think that a lot of medical practices are just crazy busy, don't have systems in place. And that's just one little piece of, what we're talking about today. What do you hear from companies, medical practices? What are they going through?
Exactly what you just described. And a part of it is because they're using antiquated systems or systems that were put out in the 1980s and 90s, and technology has advanced a lot. So instead, and those new technologies that do meet the criteria are very expensive. I mean, multiple millions of dollars. So they're in the what do I do in the meantime type position right now. And that's where our services, Just Right Business Services, come in, because we're aware of that situation that you were just talking about. Yes, that is a flagrant HIPAA violation because of that cross communication. Okay. Sure. And there's also the fact that the technology should have caught it, or they should have systems in place that would have caught that.
And accidents happen, mistakes happen. I get that. I understand that.
Yes.
But imagine if that practice was calling, expecting to call Tanya, but then called Tina, again, same last name, same date of birth, same everything, with some medical information that was sensitive or alarming. Now you're telling the wrong patient. That patient could act on that, and a chain of events could take place from that one error. But yeah, to your point, there should have been a flag there to reconfirm that they are reaching out to the right person.
Well, hopefully, if they did a follow-up, they would have done some validation before they would have shared any medical information, hopefully. But that's also one of the areas that need to be examined in most medical practices. There's scripts that the customer's verification folk are using, as well as the intake team. Also making sure that their systems are easily identifiable, meaning that every person can get to everything, all of the information that they need. That's one of the challenges with the practices, is because those solo practices or those small practices a lot of times do not have direct relationships with the X-ray or the lab, or the relationships are days in time getting a response. So helping them to bridge those gaps with some process improvement, also with sometimes just identifying what is currently required and making sure that those positions that are there are covering all of those roles. So there's a lot. There is a lot.
Tell me about your experience with the medical field.
Well, my undergraduate degree is in healthcare administration, and I earned that degree while working at Kaiser Permanente. And Kaiser Permanente is a national health, well, managed care organization, but it's a healthcare organization. And prior to that, I was also working for Prudential when they were into Medicare claims and commercial claims for the state of Philadelphia. So I've got a strong background in healthcare administration. And then I also was a lead project consultant for bridging the system or implementing a new system for Kaiser Permanente. So that kind of got me into the IT lane where I
Mm,
was implementing systems. First of all, understanding what we currently were working with. And that's a big problem because when you're so busy making sure the day-to-day is taken care of, a lot of times leaders don't have the opportunity or take the time to do a strategic vision of what is supposed to be happening within their organization. Understanding that and then seeing the results, actually measuring the results. They have KPIs, but are they measuring the right things? Customer satisfaction, being able to measure that is relatively new in the administrative world, but it's a requirement now. You need to know that you're satisfying your customers, or if you're not, and then figure out why. So there's a whole gamut, but the beauty of Just Right Business Services is that I have this plethora of information, plethora of experience, and being able to look at different scenarios, and my Six Sigma background helps me to understand processes and understand how to improve those processes, making them more efficient, specifically for the healthcare administration folk.
mm. And now let's add another layer to this, the whole insurance situation.
Mhm.
There's even more going, I'm not talking
And
about
billing.
you're the insurance company, but when it gets processed and all, that's a whole other category that we're in there.
Yes, especially with your electronic health billing, because you're sending out multiple hundreds, sometimes thousands of records at one time.
Yeah.
Everything doesn't always go through. There has to be a process to go back and look at that feedback that's coming back to make sure that the revenue's coming in that should be coming in. The things that should be paid are being paid, and those things that are being denied, you need to understand why those things are being denied. Are they rightly being denied, or should they be appealed so that you can go get that money? So there are different layers. You're right. There are different layers, especially when it comes to billing, because that also crosses over into compliance. Are you coding appropriately for the services that you're providing? That's a
Mm,
part of what United Health Group is currently going through right now. There's a lawsuit in process because the government is saying that they upbilled, meaning that they charged more or they coded a higher level of service than was actually performed. That can be a booger for a medical
mm.
practice trying to validate that they've got the right codes and that they're billing appropriately. There's a lot of layers in healthcare.
I got you on that. I'm always transparent. So I am going to say I had United Healthcare up until about a month and change ago. I'm just going to say, wasn't right for me. And just,
Well,
and
I am
pivoted.
no longer directly affiliated with them, so yeah.
I'm just saying it just, I have high
But
premiums and I was still paying a ton and uh, they need you. That's all I'm going to say. All I'm going to say they need you because a company that bazillions of dollars, even the
Mhm.
touch points. I'm going to say it. I'm going to one big challenge. Good portal to find out your medical information. Okay, when it
Mhm.
comes to paying, you have to log on to a website that looks like it was from 1998. I'm not
And it
exaggerating.
was.
It's not even mobile friendly. And you got to navigate through that, trying to see it on your phone when you just want to confirm that they got your payment. Crazy. I don't understand how that can happen with a company of that magnitude. But maybe this illustrates what's going on here that these companies are so overwhelmed that they're missing things and they need somebody like
And
you
that's,
keep an eye
yeah,
on it.
that's one of the big boys, okay? So imagine if they haven't updated their legacy system and they've
Yeah,
got billions of dollars. Think about your smaller medical groups that have
sure.
been in practice since the 90s, 2000s.
Yeah.
Yeah, they need some help. They need just right business services.
To make it just right. Uh, when we talk about how you support, I'm seeing it in two ways, and I'd love your feedback on it. One is from a consultation level where you're flying over the bleachers, you're taking a look at the systems and what's going on, making suggestions, and then letting the practice or practices implement them. Then the other side of it where you're jumping in the trench and you're actually working on them with the help of others. Is that two ways to look at what you do?
That's actually the way to look at what we do.
Okay.
Because we start off by the consultation, as you said. We want to understand your people and your processes because those two are critical
Mm,
and how they are doing what they're doing. And we'll document it, but then we'll also observe it. And that's where sometimes you see a gap between what management thought was happening and what is actually happening. Okay.
mm,
And then we can actually, from that point, we'll give you the documentation, we'll give you an overview of what we saw and the improvements that are possible with your scenario. But then we will hand it off to you if you want to do the work, or we will come in and do the work for you, or we will work with your people to train them to do the work so that they will be able to
sure.
continue to perpetually do your improvements.
What about the HR side of things? Can you support with that?
Well, what we do with that is we help to retain employees because high turnover and burnout in healthcare is real.
Oh
Okay.
yeah.
Because if hospital A is going to pay this patient account rep or customer service rep 75 cents more than the company that they're with, they're gone, especially if the benefits are not that great. So turnover is a problem because think about the fact that you had to train these people before they left.
Yep.
That's money. Okay.
Mm,
And then when you get that new person in, then somebody from your team, if you don't have, so, and even if you do have documentation, somebody from your team is taken away from doing what they would do full time and train this new person coming in. So what we do is help to retain the employees that you have and help them to better communicate with each other so you have a more synergistic team. It flows better and they are willing to collaborate because they buy in.
to
That's what
your
we
point, I was on the phone late last night with a family member who is a nurse at a geriatric healthcare facility, and they got a
do.
couple of different locations. And she says she's this time of the year she's much more busy. I'm like, why? Exactly what you just said, that the turnover is high. There are nurses graduating this time of the year, so they're now available. Others don't want to do it anymore. And the person I'm referring to, it's her job to onboard them, make sure they're ready, physicals and things like that. So yes, the
There's a
burnout rate, especially among,
exactly.
yeah, big.
And the cost. All of that costs. Yes.
Yeah. So I've given examples of some things that go awry in the medical field. Anything that stand out for you that you helped, it's all confidential, just a scenario, if you will, where you helped fix a system or you peeled back those layers and you said, "Oh my gosh, that's how you guys are doing it. You have a problem." Anything like that.
I got a quickie. And actually it was real.
Hmm.
I was working with a team who had a contract that they were implementing, and a part of their job was to request information from providers. But in their request, there were no, please respond by, give me a specific date, time that I need to have this information by. And there were no real consequences if they didn't respond and then they would have a backlog of provider responses where they didn't get a response, claims that were backed up because the providers didn't respond, and finger pointing was going on because the providers didn't respond. We looked at the actual documentation that was going out and saw that there were missing components as far as you need to send this back by. And if we don't get this, this is what we're going to do with that case. Those things were missing, and those are some fundamental things. Okay. So once we implemented that, changed the script that the customer service reps were using, and helped them to get the information and make sure and make clear what was expected of the provider and the response needed, The
Wow.
response, the backlog went down. We started to get the responses within the required time. And when cases were closed, they knew what to do. They call back, they contact them. So something as simple as making sure that your communication going out, email as well as verbal, is critical.
Yes, it is because the rest of us don't understand any of this. We just want to get help, medical
Right,
help, and pay a bill.
right, right.
It gets so complicated. It doesn't need to be. But to your point, somebody wasn't watching the ship.
But
It.
there were so many competing priorities, okay? Because I've got to get this to the boss. I've got to get this report. I got to get this data from these people. But yeah, okay, just make the call. Just make the call. Just answer the phone. Just answer the phone. And in the competing priorities, some basic fundamentals get overlooked.
Mm. So when we talk about medical practices, does it what you offer to help, does it pertain to a dental practice, cosmetic surgeon, primary care physician, and onward? Doesn't matter.
Anyone that's accepting insurance payments,
Okay.
I am their friend. Okay. Healthcare as well as home health. Anyone accepting insurance payments, I am their friend. Also, those folk that are having claims that are denied and they're just sitting there. Nobody's appealing those claims. Nobody's going back to
Mm.
validate that they were denied accurately. I am their friend. Okay.
Um, so I don't want to be the one to bring it on here, but I'm going to give another example of a practice that is just this is someone else I know who does medical billing and
Mhm.
took some time off, went back to work. There's some personal reasons, new company. This is a big medical company in the New York area. Let's just call it that.
Okay.
She goes for training, and they actually said this was the tip off. They said, "Oh, great, you came back after lunch. Most people that come here for this position, they never return from lunch." She was like, okay. She continues. She does the training. They told her, if you have any questions, don't ask them. I am
Oh,
not kidding. This is the culture of this company. So she begins the job. She stays there for, I want to say maybe 5 months or something like that. Um, they start reviewing her. They're saying, you're not being productive. We have certain numbers. You're not hitting them. She's freaking out. Turns out that they were attributing her billing cases to somebody else. The whole
mm,
thing was a complete blank show, if you will.
I understand.
And she left. She couldn't take it anymore. And just
Um,
the culture, the procedures. Again, this is a I'm going to say this is one of the top three in the Metro Long Island, New York area. Leave it at that. Big.
Tell them to call me.
Yeah, they need you bad, bad. And she would tell me these stories, and I'm so like, ah. And nobody loved working there. Even around the holidays, they would have, a party in the conference room. Nobody wanted to go. They were just, oh gosh, the management was mean. It just, but this is what's out there. And maybe there's reasons for it. Maybe people are overworked, or maybe they're not trained properly. But this lies.
Both of those, yes.
Yes, this is why we need people like you to clean up the messes that are going on there.
Help them to start to sing Kumbaya, and as opposed to get that out of here. Get out.
Exactly. Exactly. Uh, so, what else do you want people to know about the services you provide to the medical community?
Well, I want them to know that the culture shifting is also a part of what we do. And when I
Mm,
say culture shifting, that dynamic that you were just sharing, helping folk to investing in them, first of all, and then helping them to understand themselves better, their colleagues better, and learn to communicate better. Because sometimes bullies and bosses don't always know that they're being holes, okay?
mm, mm.
They don't always know because they're so focused on their next. I got to get it done. I got to get this report. If we don't hit those shareholder numbers, we're in trouble. So they're they're short with people. They don't care about that because they're so focused on their performance.
A
Okay.
100%. And in that scenario that I just described, I kind of think that the superior that was in charge of training who said, "Yeah, if you have any problems, don't call me." I have a feeling that they were fearful of their job because of the people you're training turn out to be a little bit better than you, and it gets recognized that maybe they're insecure. I don't know what it is, but certainly there's I'm sure this is going on in many practices right now.
It is. It is. But then to acknowledge it and then do something about it. That's
Right.
what we're here for.
Hmm.
Change that culture. Empower your people to better understand each themselves and each other and help them to communicate better. You'll see the fruit from the effort. That's the beginning. But then look at your processes and how you're doing what you're doing. Is it getting the result that you need? Are the people that you're serving satisfied or not? And why not? Understanding that is critical, and that can hinder or boost your revenue, depending on whether you address it or not.
So now you're located in Florida. Can you work with a practice pretty much anywhere virtually?
I can by Zoom, and I also travel. I'm also in the Mid-Atlantic. When I say Mid-Atlantic, I'm talking about DC, Maryland, Virginia area.
Okay.
So I spend my summers there primarily. So I'm kind of up from the south up to the Mid-Atlantic and back most of the time. But I also travel to Philadelphia sometimes. I have some clients there. So I can move, but technology is my friend. But I can't, when it comes to actually watching and seeing what's being done, I need to be there.
Yeah.
So
Yeah, for sure. As I remember, I worked someplace and they said there's a new sheriff in town. That could be you and needed. And by the way, you said Mid-Atlantic states. You're getting closer to Long Island, so please come here, help us. Best way to reach you? How do we do that, Laurel?
Laurel at justrightbusinessservices.com. Spell it all out. Laurel at justrightbusinessservices.com. Or you
Fantastic
can,
talking with you today.
oh, okay.
I had an idea that this is part of what you do, and you can work with businesses of any capacity. We just focused on the medical aspect today.
Right.
But I really have to tell you, you run very deep in this. We've talked before, have an idea of, what you do, but you really go deep into every area, right into, touching upon HR, billing, and all of that, and start the conversation. You're in a medical practice, doesn't matter what type, size, anything like that. You probably could use another set of eyes and somebody that's trained to do that. Thank you so much for being here today. Really appreciate it.
Thank you.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.